Hello, my friends. It's Dr. Sharon with Clinic Reviews. Today we're talking about Polycythemia vera. Have you ever heard of that? I bet some of you have not heard of it. Well, it is something that you can get tested on the NCLEX. It could be on any of your standardized tests you might take. So why miss it? Why miss those questions? You don't have to. You can watch this video and learn about it. That's coming right up. Hello, Clinic Review family. It's Dr. Sharon with Clinic Reviews, the home of the very best NCLEX review in the entire universe, in my opinion. Y'all, I have known Mark Klimek for a long time. He is a phenomenal teacher. He taught me everything, literally everything I know about teaching and about NCLEX. And you can learn from the GOAT himself if you want to take the online on-demand NCLEX review. We also have monthly tutoring, small group tutoring packages, as well as a streaming service. And I'm going to tell you a secret, y'all. I'm going to tell you a secret. I'm starting to work on a question data bank. I don't know when it's going to come out, but I'm starting to work on it. So send your good vibes, send your prayers, whatever it is you want to do for me, that I can get done with that and that we can get that out. So, all right, don't tell anybody I said that. That's a big secret. So let's go ahead and get started because we're talking about the Blue Book, and I write questions to go along with the Blue Book. The Blue Book is there in the background. You can get it at Amazon as an actual book. If you like to have books to hold in your hand, you can get that. It is facts. It's facts, but there are no NCLEX style questions to go along with it. And so I write the questions to go along with it that I do here on YouTube. So the Blue Book is the fundamental facts that you need to know. So let's go ahead. I teach, when I do Blue Book questions, I teach the content by going through the questions. So a nurse is assessing a patient diagnosed with Polycythemia vera. Which symptom is most characteristic of this condition? Ruddy skin, peripheral edema, low blood pressure, or decreased hematocrit-ish levels. So ruddy skin. So let me teach you what polycythemia vera is. It is an overproduction of red blood cells. Overproduction of red blood cells. It increases the viscosity of the serum. Okay, so the person is at high risk to develop clots. And the interesting thing is, okay, this is just pathophysiology is a fascinating thing. See, when physiology is how everything works right, pathophysiology is how things go wrong. And when something goes wrong, sometimes it just has these really strange ways and opposite ways of going wrong. So with polycythemia vera, it's increased blood viscosity by the increase in red blood cells, and they can get clots. But because of the way the body is working to break down the clots, it also can have an effect on platelets, which can then increase your risk of bleeding. So it's just a really weird phenomenon. So the reason they have ruddy skin is just because they have so many more red blood cells in their body. And so sometimes they just appear ruddy. Ruddy means red, purplish sometimes. It can be anywhere on their body. They also are prone to headaches. And they're also actually prone to bruising for the reason that I told you, that sometimes they have increased risk of bleeding. So bruising, headaches, and ruddy skin are associated with polycythemia vera. Technically, I think, because I was studying up on this so I could teach it to you, technically it seems to be a type of cancer, because anytime there's an overproduction of something, that's sort of a type of cancer. And so they actually treat it with chemotherapy. One of the ways they treat it was with chemotherapy drugs, but they're not classified as having cancer. So in other words, if someone's diagnosed with polycythemia vera, we don't go around going, they have cancer. But because of the way it's an overproduction of cells, which is what cancer is, it's sort of a type of cancer, and it's treated with chemotherapy drugs. A patient with polycythemia vera has elevated uric acid levels. Which dietary recommendation should the nurse provide? Okay, that's one thing I didn't tell you about, uric acid levels. So the breakdown of cells, or I should say cellular regeneration, breakdown and regeneration, increases uric acid levels. And so because the body is working hard to break down these red blood cells, it increases uric acid levels. The breakdown of cells is not the primary source of uric acid in the body. The primary source of uric acid in the body is dietary. But because of the breakdown of these cells, it does increase uric acid level. And so because of that, then we have to reduce the source of uric acid, the nutritional source of uric acid, okay? So what dietary recommendation should the nurse provide? Increase intake of red meats and organ meats. So that's the opposite of what we should be doing. We should decrease intake of red meats and organ meats. Limit consumption of dairy products. Dairy products are not a source of uric acid, so they don't have to limit their consumption. Encourage high purine foods. So when two answers say the same thing, neither one of them is right, okay? A and C say the same thing because red meats and organ meats are high purine foods. And you actually want to reduce purine in the diet. So you want to reduce red meats and organ meats. So you want to reduce high purine foods. So A and C are both wrong because they're going in the wrong direction, but also because if two answers say the same thing, they can't both be right, unless it's a SATA question. So wouldn't pick those. Increase fluid intake. That's actually the correct answer. So you might say, Sharon, you said nutritional recommendations. You're right. The nutritional recommendations are to limit high purine foods. That's the nutritional recommendation. But there's also a dietary recommendation, which is increase fluid intake. You actually make the blood less viscous. The more fluid you have in your body, the more water you drink or fluid you take in, the less viscous the blood is. It's less concentrated, right? So you have all these extra red blood cells. You actually reduce the concentration of that by increasing the fluid you take in. So increasing fluid. Now, just to be clear, 2,000 to 3,000 mils a day is considered normal fluid intake. 2,000 to 3,000 mils a day is normal fluid intake. So if you take in less than 2,000 mils a day, that's called a fluid restriction. If you take in more than 3,000 mils a day, that's called pushing fluids. Okay, those are just terms that we use in healthcare. When reviewing laboratory results of a patient with polycythemia vera, which finding is expected? Decreased platelet count, elevated hemoglobin level, low white blood cell count, decreased uric acid level. So we really don't expect a decreased platelet count. You can see a change in platelets, but it's not a hallmark of the disease. And so it's not actually a decreased platelet count that we expect. Elevated hemoglobin level, yes, absolutely. We expect an elevated hemoglobin and hematocrit because we have increased red blood cell production. Low white cells, no. Decreased uric acid, no. We actually would expect an increased uric acid level, if anything. So we have that. That is the correct answer. A patient with polycythemia vera is prescribed hydroxyurea. What is the primary purpose of this medication? To reduce blood viscosity, to increase platelet production, to stimulate white blood cell formation, or to lower uric acid levels. This is that chemotherapy drug that I was telling you about, and it reduces cellular turnover. So hydroxyurea is one of the first line drugs for polycythemia vera. This is actually not in the blue book, so I did want to make sure that you know this. It's one of the first line drugs for treatment. It reduces cellular turnover. Whenever you prevent cells from reproducing, that's considered a chemotherapy drug because chemotherapy kills cells, right? And so reducing the reproduction or the turnover of cells is in essence killing off cells. So it is considered a chemotherapy drug, but it's primarily used for blood disorders. The nurse is planning care for a patient with polycythemia vera. Which intervention is most important to prevent complications? Encouraging active range of motion exercises, maintaining a low sodium diet, promoting hydration with at least 3 liters of fluid per day, or administering iron supplements as prescribed. All right, so we know that they are prone to increased blood viscosity, and we know that they can be prone to clots because of that. So it seems like active range of motion exercises might not be a bad thing. I would rather they walk or something, but I mean, I would rather they walk. So active range of motion exercises is not terrible. It's not as good as, say, going for a walk. Maintaining a low sodium diet, that doesn't do anything. Promoting hydration with at least 3 liters of fluid a day. That's actually critically important, and it's part of the it's part of the standard care for the person with polycythemia vera, administering iron supplements as prescribed. So that we definitely don't want to do that. Don't do that. All right, because that increases the production of red blood cells. So I have to choose between A and C, and it's a most important or best. So I can only do one thing. So because promoting hydration is part of the standard of care for treating polycythemia vera, I want to show the National Council of State Boards of Nursing that I know that to be the case. If you're wondering why I'm not going to pick A, it's because that's not as good as exercise. Okay, active range of motion exercises is a type of exercise, right? Like to do this, but it's not nearly as good as walking. And I really have to encourage increased hydration. Like that is something I have to do. So that's why I'm not picking A. A patient with polycythemia vera is undergoing phlebotomy, which again is the most common treatment, y'all. Draining blood off of them. Can you believe we still do that? Like, can you believe we leech them? We're leeches. We just pull the blood off of them. That's what leeches used to do, is they'd come in and suck blood out of people. They used to think that when people got sick, that if they could drain the blood out, they could drain all the toxins out. I don't know how often that worked. I don't think that's generally a treatment that works for most things, but it does work for polycythemia vera. Phlebotomy. The nurse explains that this procedure helps by removing excess iron from the bloodstream, lowering elevated uric acid levels, increasing platelet concentration, decreasing blood volume and viscosity. So it has to be D because that's the problem in polycythemia vera. Which of the following lab values would the nurse expect in a patient with polycythemia vera? So you do have to know some normal values. I don't know the normal value for uric acid. So unless all the other ones are clearly the wrong answer, I am not going to pick uric acid, because I don't pick an answer that I don't know is right unless I've ruled out all the other answers as absolutely wrong. So hemoglobin is low, 9. Normal is 12 to 18. So hemoglobin of 9 is low. I would expect it to be high, so I'm not going to pick that. Now, you do not have to memorize hematocrit levels. You've got to memorize hemoglobin levels. Hematocrit is 3 times the hemoglobin. So if normal hemoglobin is 12 to 18, multiply that times 3. If normal hemoglobin is 12 to 18, then hematocrit is 36 to 54. All right. So the hematocrit is elevated. Okay. Hematocrit is elevated. So I go, oh, that's elevated. That's what I would expect. Platelet count of 150,000. That's the low end of normal. And so it's not low. It's the low end of normal. And so I'm not going to pick it. So I'm picking hematocrit because I know for sure that one would be elevated. I would expect hemoglobin and hematocrit to be elevated. Although I would probably expect hematocrit to be elevated more than hemoglobin a little bit, because hematocrit represents the concentration. A patient with polycythemia vera reports severe pain in the big toe. What is the most likely cause? Gout, thrombocytopenia-induced bleeding. Thrombocytopenia is low platelets. Diabetic neuropathy, peripheral neuropathy. Well, C and D are the same thing. Diabetic neuropathy and peripheral neuropathy are the same thing. There's no reason to think polycythemia vera causes neuropathy. I told you what the symptoms are: headache, ruddy complexion, and bleeding. So could it be pain from thrombocytopenia-induced bleeding? Well, it could be, but unlikely. Remember, anything could be the case. You want to find things that are likely the case, okay, or often or in general the case. And we know uric acid goes up, right? And uric acid causes what? Uric acid causes gout, which is why people with gout have to decrease purine-rich foods. They can't eat organ meats or a lot of red meat, so forth. So, yeah, it's likely gout. That's typical gout pain. When teaching a patient about Myloran bisulfan therapy for polycythemia vera, which statement should the nurse include? This medication will decrease your white blood cell count to fight infection. You may experience increased hair growth while on this medication. Regular blood tests are necessary to monitor your bone marrow function. This medication will help increase your energy levels. Well, you know it's given for polycythemia vera, and you know that polycythemia vera is increased red blood cell production, which occurs in the bone marrow. So if we're suppressing red blood cell production, we are suppressing bone marrow function. So it makes sense. If we're just using our common sense, we would want to pick this. So what I'm trying to teach you is how, if you're given the name of a drug that you've never heard of, but you are given the name of the disease, use the disease to figure out what the drug does. Now, Myloran is in the blue book. It's not used as much anymore. There was a time where they thought Myloran caused enlarged spleen. I'm not going to go into all the reasons why they thought that. It had to do with platelet production, because spleens are made platelets are housed in the spleen. So they thought it increased the size of the splenomegaly is the word for it. But there's really once they studied it, there's really no evidence that Myloran causes splenomegaly. So it is okay to give, but because it kind of got this bad reputation for a while, it's not nearly as prescribed as frequently, but you still could get it on the NCLEX. A nurse is providing discharge instructions to a patient with polycythemia vera. Which statement indicates the patient understands how to prevent complications? I will limit my fluid intake. No, absolutely not, because we want to prevent complications. Okay, I will. So we're looking for the true statement. I will limit my fluid intake. No, I need to avoid crossing my legs when sitting. Maybe. Let's see what the other answers are. I should increase my intake of iron-rich foods. No, absolutely not, because that's only increases red blood cell production. I can take over-the-counter antihistamines for itching without consulting my doctor. Okay, that's another common symptom of polycythemia vera, actually, is itching. I didn't tell you that. It is in the blue book. Itching is a common symptom associated with polycythemia vera. So I say, well, yeah, go ahead, take antihistamines. However, there's a red flag word in here: without consulting my doctor. Y'all, don't ever tell a patient on the NCLEX they can take something over the counter without consulting their doctor. If it just said, I can take over the counter antihistamines for itching, that would be the right answer. But it says specifically without consulting my doctor. And since it says that specifically, I can't pick it, because I don't ever want to tell somebody don't consult the doctor. And if the entire answer isn't right, then the answer's not right. Now, you might say, well, then why can you tell them to take antihistamines? The assumption is if they're coming to you, that's the equivalent of consulting with their doctor, right? If you're doing patient teaching about a disease, you can assume that you can teach about managing the side effects of the disease or the side effects of the medication. But they're specifically saying without consulting my doctor, then I can't tell the National Council of State Boards of Nursing, I'm going to tell them it's okay to take over the counter stuff without consulting their doctor. So I have to go back to B and look at that. I need to avoid crossing my legs when sitting. Well, what does crossing your legs do? So if you don't know this, crossing your legs while sitting has, there's some relationship between that and DVT. It's sort of like long airplane rides can increase your risk for DVT. So crossing your legs stagnates blood flow a little bit. It slows the blood flow down because you're just putting pressure on the vessels that way. So it would be true that they should avoid crossing their legs when sitting if they're more prone to getting blood clots. A patient with polycythemia vera is prescribed allopurinol. The nurse understands that the purpose of this medication is to. All right. So I just told you if they give you the name of a drug and the disease, that you should assume it's used to treat the disease. Well, let's see if that holds true here. Reduce the production of red blood cells. Yeah, allopurinol doesn't do that. Lower platelet counts. Allopurinol doesn't do that. Treat pruritus associated with disease. Pruritus is itching. It doesn't do that. Decrease uric acid levels to prevent gout. That's what it does. So you're going to have to just memorize what allopurinol is. If they said they're given allopurinol to treat gout, then you would know what it was. But actually, allopurinol is used to treat a complication associated with polycythemia vera. So I would know allopurinol. I bet most of you know what that's for. I bet most of you do. It seems like it's a gout medication that everybody knows, but I would know it. I wouldn't depend on just knowing the disease to go along with it. After assessing a client admitted with polycythemia vera, which of the following is the nurse most concerned about? All right. After assessing a client admitted with polycythemia vera, which of the following is the nurse most concerned about? I'm always most concerned about unexpected findings. So if it's a typical sign or symptom of polycythemia vera, I'm not as concerned about it as I am about unexpected findings. Right calf larger than the left. Well, that's not expected. A ruddy complexion, that's expected. Bleeding gums after brushing their teeth, that's actually expected. Complaints of, sorry for the typo, of frequent itching. That's actually expected. The only unexpected finding here is the right calf larger than the left, which could indicate a DVT. And do not say, but that's a symptom of polycythemia. No, it's not. It is a complication of polycythemia vera. All the others are symptoms of the disease. A is a complication of the disease. All right. I hope you understand the difference between a symptom of the disease and a complication. Complications are unexpected, symptoms are expected. So I hope that was helpful to you, and I will see you later. Thanks for being a part of the Clinic Review family. Have a great day.